see if we're on the right. Yeah. Can you see? Right, so we thought we would just do a live demonstration of some microneedling with radio frequency because we're getting loads of enquiries about it. And we've done various videos and people come in and have consultation and we answer all the questions then. But it's quite nice for you to be able to see it in action because we don't always know what it involves or how much it's going to hurt or anything like that. So if you can see it happening in real life, then you get a little bit more of an idea. I'm just going to turn it down a little bit. Alexa, volume down. So Emily's already cleansed and prepped ready, so we will just be able to crack on and do it. Emily is 34 and it's just nice to know kind of any age range this is suitable for. So people will get different benefits from different things out of this, but Emily predominantly likes the radiance that it gives her skin. It's really good for pore size. So people who's got quite visible pores, this is really good at making the appearance a lot smaller. It never makes them disappear or anything like that, but the appearance is a lot better, and she's overdue having another one. We tend to do these even just a couple of times a year now, maintenance wise, usually kind of back end of the year. So that's why we're going to do Emily's today. She's just been a nice model for us, aren't you, Emily? Yeah. So a lot of people ask, does it hurt? I don't think it particularly hurts. It can be uncomfortable at different places on your face, especially kind of forehead, around your eyes, sometimes top lip. Everything is sensitive on the top lip, so it might just feel a little bit more discomfort there than anyway. So I've got a sore throat. I think it's like hay fever. So it's not massively uncomfortable. It's just a little bit, but it's bearable. Everybody seems to just kind of get in the zone. Once you see the machine come on and see what it actually does and how it works, you can see how it's different from actually using the pen, which is the more traditional way of microneedling. So we use a head on our radio frequency ones that's got more needles in. So on a pen you might get anything up to either 6, 12, 24 needles, but these ones, the ones we like best for around the face, has got 49 needles, which actually disperses the pain a little bit as well. So it's a little bit more comfortable than having a really small configuration of needles. So we'll just load this up ready. We're not on. Why aren't we turned on? We put the wrong one. Technical hitch. Let me just plug this machine back in. This must have been the other one. Just small talk, Emily. Oh no.
I'm not used to being on camera.
What have I plugged? Oh, I unplugged the wrong one already. What's the one we plugged? Oh, that's my fault. trying to put more lights on and I've unplugged the machine. So anyway, we're on. But I'm just going to change my gloves now. I've just been raking around on the floor. So we work in like safety parameters, different areas at different depths. So as long as we're working safely within those areas, then we're going to minimise anything long term or any risks that you might have seen with these kind of machines. We're not looking to make the client bleed, we're not looking to go as deep as possible, we just want a really good response from the skin. So everybody's completely different, so what you might use on one person might be completely different on another person, depending on how thick the skin is, what other things they've got going on, or what concerns you're treating, whether it is just premature aging, fine lines, wrinkles, or whether it is, you know, more down the acne, scarring kind of route. So we don't need to do anything too major on Emily's, but she's got nice plump skin, so we can get a good setting on here. Okay. So we tend to start, I usually just start around here. Where do you start, Emily? Just on the cheek?
Yeah, I sometimes start on the neck. It depends if you're doing the neck area or not. But yeah, usually on the...
So I'm not sure if you can see actually on this one how this machine works differently to a traditional pen. So with a pen, you tend to just move it over the surface of the skin. So you're always not dragging it over, but it's more surface related, so it does create more trauma on the skin, which makes it a little bit more uncomfortable, that people don't necessarily can like that as much. Whereas this one it's actually sucking the skin into the head of the machine. Then once the needles are delivered at the depth that we've set it on, it then delivers the heat from the radio frequency. So that's what creates more of a reaction that's going to work deep in the dermis rather than just on the surface like you do with a pen. It's quite a mechanical process really, so I just feel it's a lot more bearable than doing it over with the pen, where you can't always control how much pressure you're putting on. How's it feel?
Yeah.
Alright.
A little bit nippy to start with, but it's fine. Bearable.
Bearable, you see, as long as it's bearable. I don't tend to use numbing cream with these. I want to see what's happening with the skin. So with topical numbing creams, it's taking the blood away from the surface, so you don't get the erythema straight away, which really, I like to see how much it's creating. Most people do find it bearable. And it can be done on any skin type, even if people have got darker skin as well, because the heat is all happening underneath the skin and more in the dermis rather than on the surface. As long as we're working within our safety parameters. Then it's okay to use. We'd always advise clients not to use any retinols. Probably probably a couple of weeks before you were having the treatment. You wouldn't be able to have this treatment either if you had any immune system conditions or blood thinners. If you're on blood thinners, it's not advisable to have, and not when you're pregnant or breastfeeding either. So you can see it creates, I don't know if you can see on there, redness. So this redness after the treatment is usually, I'd say, up to 48 hours. Most people it's gone down by the next day. So just try and plan it, maybe when you don't have anything on the next day, because we'll just be telling you to be makeup free for 24 hours. Be vigilant with SPF, because any advanced treatments, heat treatments, you do need to be putting your SPF on. You need to put it on anyway, just for anti-aging purposes, but definitely after having any advanced treatments. If you've got any particular areas of real concern, say it was around your eyes or the crow's feet or top lip, sometimes they're smoker's lines, even though they're not from smoking, it is just a muscle, we can actually go over those areas a lot more. Emily's only young, she didn't have any of those concerns. After using the traditional pen, which I probably did for about 3 years before we got this machine, in comparison now, from carrying out both the treatments and seeing the results from both, I will always opt for this one now. It's just a lot more comfortable for the client. I find the results are far more increased with the radio frequency than what they are with the pen. I just feel like it's doing so much more. And after using the radio frequency prior to getting this one with the IPL, I liked the results that it did with the IPL. So having that mixed with the microneedling is just like microneedling on steroids, basically. I just love it. And I think with this machine lifting the skin off the surface, it makes it a lot more comfortable. It's not just being dragged over the surface of the skin. It's lifting it up, delivering the needles, and then delivering the radio frequency heat at the depth that we're putting it at. So whether it's 1 millimetre or 0.8 of a millimetre, depending where we're working, that's going to create that reaction to then get your collagen and elastin back into production. Just creating that trauma puts your skin back into natural healing mode. So it's going to plump out those premature aging lines. Tightening all under your jawline, which is a really good benefit of this machine. In fact, that's probably where we see the most results, don't we?
Yeah.
That and like round the eyes.
Yeah.
And just overall evening out skin tone. So if you've got quite an uneven skin tone, so you wear foundation just to blend it all together. If you've got redness and that kind of thing, this evens out the whole surface. So you'll be red straight afterwards, but then we do put you under the LED lamp. We've got a Dermalux Tri-Wave LED, which is really powerful, and it works really well with this afterwards in accelerating your results, but it also calms some of the redness down. Plus it's nice to have something relaxing to go under after you've had this done for half an hour.
It's everyone's favourite thing.
Yeah. Visible results from this treatment are usually between 2 and 4 weeks after each treatment. So we always recommend a course of 3 to 6, depending on what concerns it is that we're doing. But those visible results are usually like 4 weeks after your last treatment. It just takes your skin that long to rejuvenate. So that's why it's not an instant fix, but it's kind of long-term results. So once people have had a course, we'll just recommend maintenance once a year or twice a year if people like what it does. And you might just have one treatment then. You don't necessarily have to have a course again because the results are permanent. So if you do have injectable treatments, which work really well with this, you obviously need your skin texture to look its best. There's no point having Botox and fillers and just having a rubbish surface with everything else going on underneath. So this is going to give you the ultimate finish for your skin. Tony. Hi, Tony. Ah. Who else is on there? Emily. Hi, Emily. Ah, Stuart. Yay. Number one fan. Anything else written down about that? I can't remember.
Side effects?
Yeah, so this treatment is really good for acne scarring. So if you do have even old acne scarring, it works really well on this. You might need, 3 to 6 treatments on that, but the difference is amazing. We just can't treat active acne, so if you've got a lot going on already that's fairly active, we'll just wait until it's calmed down, or we'll look at treating that first, even with the LED. And then once it's not active, then we can treat the skin. We don't want to be spreading any infection around the surface of the skin. Oh, it's a bit nippy, this bit. Well done, Emily.
How long have the results last?
So results are permanent, but I would say a good year. Definitely, if you had it done once a year, you would maintain the results. Right, I'll just go under here. Try to put my head in the way. Feel the heat coming from the skin.
Feels a little bit like you have sunburn.
Yeah, so it's a feeling of like sunburn
Mm.
without the damage though.
Yeah.
So it's creating a really good reaction, and she's not trying to climb off the bed. So, as much as we say it's needles and there's 49 needles, it's actually very bearable. So don't worry too much. We've actually still got the first session on for half price as well. So if you want to try the first session, it's £125 for the first one. And the appointment itself is about an hour. We're not going to be on an hour, but it's about an hour long. From coming in to then going under the LED lamp after you've had it done to when you're leaving. So like with any heat treatments, straight afterwards we'll be saying no the heat treatments, so no swimming, saunas, jacuzzis, definitely no sunbeds. I'm surprised how many people still use them, but anyway, no sunbeds, be vigilant with your SPF, no makeup for 24 hours. This is just for risk of infection as well, so and then if you do use any active products, retinols, anything like that, again, just, I wouldn't use them whilst you're having these treatments done. So even though I might say don't use them for a week leading up to it for it, just whilst you're having these done, because it's so strong, I would just hang off using them for now. And then you can go back to using them after you finish your course, probably 3 weeks after. You just don't want to overdo things. I know there's so many things on social media at the moment, different skincare, try this, try that, and people just get sucked into thinking, oh yeah, she's saying that's really good, so it must be good on my skin. And it might be too strong. Everybody's skin is so different, so what a celebrity or a social media influencer might say is good for their skin, it might not necessarily be good for yours. So just be really mindful when you're social media shopping. It's lethal. Anything with skin as well is, you're in it for the long term. Don't think of skin being a quick fix. You're not going to get results from lots of different things in a month. Treat things like this for over 12 months. See how different it's going to be in 12 months' time. And what you can do within those 12 months that's going to benefit it overall. Because different things do different things to your skin. You always need a really good home care routine to get the benefit of having professional treatments done. There's no point just doing nothing and expecting miracles from professional treatments. They all need to work together. Right then, I think we're about done. So I'm just going to pop the cold hammer on afterwards, which is always a nice relief after having all that heat on there. Have we answered anything, Lola? So, have we answered anything?
I think so.
No, it's all right then. There we go, and that's it. So now I'll be cleaning it down and then just popping it under the LED treatment, the LED lamp. So I tend to go for the near infrared light and the blue light for antibacterial when we're putting in post-treatment. So that's really good because we've pierced the skin, so really good for any antibacterial, anything that's going on surface-wise. And then the near infrared light is really good for calming, healing and inflammation that we've just created. So it's just going to take all that redness back down. I'll do another video another day on the LED, because that is just one of the best machines we've got here, that can be used by anybody for all sorts of different things. So unless anybody else has got anything else they want to ask, I'll finish this off, and we'll let's just plan another. If anybody else wants to see another treatment in progress, sometimes it's just quite nice to see them actually happening, rather than just on a shortened video, and then we'll just plan something else, and hopefully the machines will be plugged in next time. But thank you everybody for joining us who watched, and I'll put it on the page so people can watch it at different times. I know people will be at work and stuff, so thanks very much. See you later. Bye.